Well, EAP is equine-assisted psychotherapy, and actually what we are pursuing here today is EAL, equine-assisted learning. Equine-assisted learning is a very experiential process, meaning that it requires you to be in the moment and to do. You learn by doing. It's completely nonverbal. You have to use your body as the instrument of communication, and what we do affects the horse. They have so much to teach us about subtlety. That's the biggest fundamental component to what's going to make this so effective in training new therapists in the industry.
That's a sign they're comfortable, they're relaxed, and so forth. So what Maria is struggling with here is learning to read intentionality. You're going to put just the right amount of pressure on that Curly Fries recognizes it and gives to the pressure. He will feel it, he will register it, he will seek relief from that pressure. Tell him to put his nose on it.
Put your nose on it. Come on.
Touch it.
Come on.
That's it. That's it.
Come on.
That's it. Good boy.
Good boy.
As soon as we say good boy, we'll take it away.
Dr. Wise, I couldn't ask for a better mentor. She has such an enthusiasm. She's a believer in the process and how it can effectively teach.
What I'm going to ask Missy to do is to choose a problem from her own life, a conflict. We all have them. I don't care how superficial it is or how deep it is. And she is going to choose some issue to work on.
I want them to walk together peacefully, harmoniously, but to keep walking. Because if they stop, they might think too much. It definitely challenged me as a clinician. I felt more connectivity to the female in the relationship. She seemed more compliant to go along with the directional cues I was giving. And he, I noticed, the larger horse, was a lot more circumventing of my attempts. And I felt like he was a lot more resistant to the process. Because this little guy is more compliant. He's giving me 2 eyes. He's saying, all right, what do you want from me? And this guy is out to lunch. He doesn't even care about this process. Yeah, because I feel like there's no momentum. I'm frustrated. They're standing there. It's not okay to just stand here in this anymore. I'm suffering. I need you guys to move together so that I can take a rest because I'm taking all of this on myself. It hurt. It was an unexpected setback, just like we have in therapy. And so I immediately, I collected myself and got a little bit of self-pity going, and Dr. Wise said, just stand there. I'm very uncomfortable right now. I want to move.
Where do you feel the discomfort?
I feel like I want to burst into tears, so behind my eyes.
Okay, behind your
my
eyes.
Throat.
And your throat. Mm-hmm. Okay, just kind of stay with that.
There's an honesty that you can receive from an animal. I think the reason that the animals are so effective at teaching us these sort of clinical skills or skills that we'll use in the therapy room is the fact that they're so, as Dr. Wise would say, immediate, accurate with their feedback, non-judgmental, and the horses are our best emotional mirrors to check us as clinicians. I've been through, the traditional academic, sitting in the classroom, reading the books, taking the tests, and it's all very valuable, and it's of course the foundation of all that we know. However, I think this is nature's classroom, and there's just so much to be learned that you can access here that you just can't access in the classroom. And I strongly believe in horses as the instrumentation for enlightenment. I believe in this process, and these horses have a lot to offer.